Hi everyone, my name's Brian, and I just wanted to share a little bit about myself before I got into this presentation. I'm currently in recovery for alcoholism. I had 3.5 years of continuous sobriety. So this is a topic that's personal to me. I'm actually a student in the addiction psychology program, and this course was just something that I wanted to take this summer while I had the opportunity. Professor was kind enough to let me jump in, so I appreciate that. And then I just obviously picked, alcoholism as my subject, as it's very personal to me, and I can directly relate to most of, if not all of the things about withdrawal, especially early withdrawal, because it was something I experienced the first time I tried to quit drinking, which was just going cold turkey, uh, which probably wasn't the best approach, as we'll kind of learn through these upcoming few slides. So let's just get started with the introduction and the DSM-5 and diagnosis. According to the Diagnostic and Statistical Manual of Mental Disorders, or the DSM-5, clinical withdrawal occurs when someone significantly reduces or completely stops heavy drinking. The sudden cessation disrupts the brain's chemistry, triggering a state of central nervous system hyperexcitability. To meet this diagnosis for withdrawal, someone must present at least two distinct clinical markers within 6 to 24 hours after the last drink. It's not just a hangover, though. It's a profound physiological rebellion. Understanding this timeline is critical for medical doctors, as an early identification directly prevents severe life-threatening prognosis. So what are the first symptoms in the initial 24 hours? Within the first day of stopping, the body enters a state of autonomic hyperactivity. The nervous system loses its primary depressant, causing vital signs to spike unpredictably. Physically, people experience a rapid heart rate, often exceeding 100 beats per minute, alongside elevated blood pressure and heavy visible sweating, medically known as diaphoresis. And it's rapid heartbeat and the night sweats are not present. Simultaneously, the gastrointestinal tract reacts violently. People suffer from nausea, frequent vomiting, complete loss of appetite, and often dehydration. Perhaps the most well-known early physical sign is the motor tremor. These involuntary shakes typically manifest in the hands and upper extremities. They serve as a clear visual anchor signaling that the body is actively entering a state of physical distress. Oftentimes, I couldn't even type on try and use my phone because I was just shaking so uh, tremendously. Long way. So some of the associated behavioral and psychological symptoms. As the physical symptoms take hold, psychological and behavioral shifts happen concurrently. The sudden lack of alcohol causes an immediate surge in emotional distress, presenting as severe anxiety, intense nervousness, and profound irritability. Behaviorally, this manifests as a psychomotor agitation. People can't sit still, they pace, fidget, and remain in a continuous, exhausting state of being on edge. This hyper-alert state severely disrupts their ability to rest. Patients experience profound insomnia, often compounded with terrifying nightmares when they do manage to fall asleep. These behavioral symptoms are not just psychological reactions to being sick. They're direct chemical results of an unmasked, overstimulated brain trying to function without alcohol. The next 24 to 72 hours, there's severe escalation and accompanying complication. If your withdrawal progresses past the 24-hour mark without medical intervention, the symptoms can escalate from distressing to highly dangerous. Between 24 and 72 hours, some patients experience hallucinations. These are transient visual, tactile, or auditory hallucinations. Someone might see insects or feel crawling sensations on their skin. Yet Often they maintain a clear, conscious grasp of reality. This window carries a high risk for withdrawal seizures. These are severe, generalized tonic-clonic episodes that hit someday. Finally, the most severe complication is delirium tremens, or the DTs, also known as the DEETs. Peaking around 48 to 72 hours, DTs are a true medical emergency, characterized by profound confusion, total disorientation, severe agitation, and dangerous spikes in body temperature. And so, how do we assess this situation? To manage these shifting symptoms safely, doctors rely on objective standardized measurement tools. The gold standard is known as the Clinical Institute Withdrawal Assessment for Alcohol, universally known as the CIWA-AR scale. Rather than relying on guesswork, clinicians use this 10-item survey to systematically grade a patient's current physical and psychological distress. It assigns a number value to categories we've discussed, including tremors, anxiety, nausea, sweating, and tactile disturbances. The final calculated score ranges from 0 to 67 points. By utilizing this precise tool, doctors can objectify patient care, accurately characterize the withdrawal as mild, moderate, or severe, and immediately tailor medical protocols to ensure a patient's safety.